What should I be aware of when my patients ask me about non-steroidal anti-inflammatory drugs for musculoskeletal pain? Many patients assume that over-the-counter medications like some anti-inflammatory drugs are completely safe because they don't require a prescription. However, these kinds of drugs can cause significant side effects, especially with long-term use. Short-term use is generally safe, but prolonged intake increases risks. Let's see some side effects. 1. Anti-inflammatory drugs can cause gastrointestinal issues like ulcers or bleeding. 2. Long-term use is never recommended for nonspecific musculoskeletal pain, and it is associated with increased risks of heart attack and stroke. 3. Kidney function could be impaired due to anti-inflammatory drugs, especially in high-risk individuals. Remember, some patients are more vulnerable to NSAIDs, and even if it is available over the counter, these patients should always discuss it with their doctors before using NSAIDs. A common misunderstanding is that if a patient cannot take NSAIDs for back or neck pain, then opioids are an alternative. This is not true. Firstly, because the side effects and rates of adverse events of any opioid-containing product are higher than those of NSAIDs, including dizziness and risk of falling. Secondly, because the effect of opioids does not merit the risk of developing long-term side effects such as addiction. How to address this belief in patients? 1. Identify conditions linked to higher risk from anti-inflammatory drugs. These risks include patients above 65 years of age with a history of ulcers, with ischemic heart disease, taking medication that may interact with NSAIDs, and with hypertension or increased risk of thrombosis. 2. Encourage non-pharmacological approaches for pain management, such as self-administered heat, movement, and distraction. 3. Reinforce that prolonged or excessive drug consumption does not necessarily enhance effectiveness and can cause harm. If they are in doubt, they should talk to their general practitioner. And 4. Explain when to seek medical advice. Let's put it in practice. Emily is a 45-year-old woman who takes ibuprofen daily for hip pain and increases the dose during pain flare-ups. She assumes its continued use is harmless.
I see you've been using ibuprofen daily. Can we talk about its long-term effects?
Yes, of course. I take it every day. I figured it's fine since it's over the counter.
Ibuprofen can be useful, but it can also cause stomach and kidney issues. Have you heard of Peace and Love?
No, what's that?
It's a way to manage short-lasting pain without over-relying on medications. Peace helps early recovery by protecting the area, avoiding medication intake and ice. Love focuses on long-term healing through movement, optimism, and strengthening. A similar approach could be used for your hip pain flare-ups.
So instead of just taking ibuprofen, I should focus on movement and gradual strengthening?
Exactly. Ibuprofen can help short-term, but incorporating movement and load adaptation will support lasting recovery without long-term medication risks. But remember to reach out to your general practitioner if you are unsure. Let's work together to come up with an exercise plan.
To sum up, educating patients on appropriate anti-inflammatory drug use and alternative strategies can prevent complications and promote better pain management.